because I think, I want to give a round of applause to Nolani for her wonderful set of introductory exercises. I think there couldn't have been a better way for us to begin to enter into a discussion around collective impact. Because at its heart, collective impact really is about systems change. We talk about it as cross-sector partnerships that are highly structured to address a complex social problem, but really, at its heart, it's about systems change. So thank you so much, Nolani. I think that was a really helpful way for us to get into this. I'd also just like to thank the United Way of Pierce County, to Rick and to Pam for having me here today. I'm just delighted to be here and so excited to hear about a lot of the momentum that is happening in Tacoma and this community around collaborative action. And I'd also love to thank our sponsors for today. Obviously, this is just a fabulous, fabulous gathering. So we're here to talk about collective impact, and I don't want to make assumptions. We've been talking a lot about that term this morning, but I'm curious how many of you are familiar with the concepts, have read the articles, are familiar with the concepts of collective impact? All right, some of you. Okay, good. So I'll go into a little bit more detail on that. And then how many of you would you say are doing it, actually doing collective impact in your work every day? Okay, a handful. Great. I have more to talk with you about later as well. So that's great to hear. And I have one more question for you. And that is, how many of you in this room today really feel like you are here to make a difference in people's lives? Raise your hand. Yeah, me too. I think that's something that we really all have in common, and really is what this is about today. So if we take a minute and stand back to look at the big picture, what's going on in our organizations, our communities, in our world. From a view of 50,000 feet, what do you see? Do you see the problems that we face as a society as depressing and insurmountable? Or does it feel like we're on the verge of something exciting and unprecedented? Now, most of us, if you're like me, that spend our lives trying to improve the lives of others, teeter back and forth between these two extremes. It kind of depends on what morning it is when I wake up, in terms of, will the future be depressing and bring problems that are insurmountable, or will it bring something exciting and unprecedented? But whether we see our future as glass half empty or glass half full, many of us have the same big picture question, which is, why is it that we're not making better, faster, larger progress against these really tough social problems that all of us are facing every day? Whether it's problems in health, in education, in the environment, in poverty, there are many, many reasons that all of us in this room can give today, I'm sure, about why we haven't made more progress. As a starter, we don't have financial resources. Nolani talked about that. We don't have enough money to achieve scale outcomes. The public will is not there to make the sacrifice for change. We don't have enough of the right talent, the right human capital to get the job done. Well, these are all significant challenges, to be sure, but I would submit that the single biggest challenge is not any of these. It's actually our ability and the fact that we take an isolated approach to solving social problems. So much of the social sector is focusing on individual organizations and what they can do in isolation from one another. And that isn't to say that there aren't many, many, many very strong and effective organizations out there. There are, that are working hard every day to make a difference, that have strong leadership, that have clear visions of change, excellent strategic plans. They exist. But the problem is that these organizations can't do it alone. They are necessary, but they are not sufficient for change. And too many of these organizations and leaders are working in isolation from one another, in the same geography, often with the same populations, but not together. just to give you an example, in a Northeast city that we found, just 85,000 people, we found that there were 280 youth development organizations working in this one community. And very little of them had any contact with the other 279 youth development organizations that were working with, in many cases, the same kids. And this is something that you see play out again and again and again across issue after issue. So what if we were to change the way that we operate in the social sector today? What if we were to move from a world of funders, nonprofits, government and businesses attempting to achieve isolated impact to a world where organizations work across sectors to achieve collective impact and to really address the large-scale problems that we're facing today? What we propose is collective impact. It's not just collaboration. It's not just partnership. It's something far more specific and rigorous, where all the actors that are working on a problem are working towards the same goal, they're measuring the same things, and they're working across sectors. It's not just nonprofits and funders, it's government and corporations that are also at the table. That's what we mean by collective impact. So, why collective impact? And I wanted to tell you all a story about this, and I think really illustrates what I mean. It gets back to some of the discussions that we were just having about the system, what we mean by systems. This story is about a girl, and it's a true story. And her name is Emily. She is 15 years old. She is African American. She's pregnant. She's poor, and she lives with her aunt in Staten Island, which is a borough of New York City. And in a moment of weakness, did I mention to you that she's 15 years old? She shoplifts a pair of $80 shoes, and she's caught. It's her first and only offense. So she goes to court, and she's put on parole. But unfortunately, she violates her parole because she misses a day of school to go to a doctor's appointment. And she winds up in a limited secure facility for almost a year. The facility is located 2 hours upstate, so it's really difficult for her aunt to go and visit her. Now, the problem is that this is a horrible situation, and Emily's not alone. In fact, if you look at the juvenile justice system in New York, over half of the roughly 1,600 youth that are moving through that system every year and incarcerated have a misdemeanor as their most serious offense. We're talking about a broken system here. It is inefficient, it's ineffective, and it's unsafe. It's not delivering on outcomes for youth. It's not delivering on public safety. And in fact, if you look at the youth who end up in secure facilities in New York, there's a 90% recidivism rate. They go back to jail. And it costs the state $290,000 a year. This is truly a broken system. But when we talk about systems, what exactly are we talking about when we say the New York juvenile justice system? Well, we're talking about hundreds of public agencies that span the courts, law enforcement, probation, county services, state agencies, and you can multiply that out across 62 counties across the state. Then you need to take into account that the juvenile justice system has to coordinate with education, mental health, child welfare, to serve the youth while they're in state care and then really help them to responsibly transition back into their communities. And today, this is clearly not happening to the degree that it needs to. So, how do you solve a problem like this? Well, one thing is clear. A single intervention is not going to do it. Scaling up one nonprofit or one program, reforming one state agency, passing one law is not going to solve a problem like this. This is truly a complex social problem. So, what do you do about a problem like this? And I can tell you that there's a start. So we worked with a group, a steering committee, over about a year of folks across the state that touch the New York juvenile justice system. So this included folks that had never come to the table before together, heads of the police, advocacy groups, courts, probation, state agencies, private agencies, educational players, folks that not only had not come to the table together before, but frankly did not see eye to eye. These were not easy meetings. But I can tell you that over a course of a year and through many, many, many meetings that included other stakeholders across the state as well, and using data as a starting point, what is the problem? This group came to a common vision for the state around youth outcomes and public safety. And they came up with an initial set of strategies that really touched the entire system, from initial contact to when kids are released through into their communities. And there was a backbone organization, so a coordinating entity that now was set up and now exists inside of the governor's office, fully staffed, that helps all these different groups to meet and coordinate and work together more effectively. And as a direct result of this work, we've also seen legislative change. So word for word from what the recommendations of this group came up with was passed into law. And what that means is that youth like Emily will not be placed in facilities that are far from their families and their homes. They'll be placed close to their families. And it also means that there will be alternative sentencing options for judges so that youth like Emily don't have to go into a secure facility. So we're beginning to see some real change as a result of the systems players coming together and seeing the problem in a joint way. So when collective impact efforts are firing on all cylinders, literally what we see is hundreds of organizations that can be working together in an aligned and coordinated fashion. So how is this possible? In this case, nature helps to show us the way. So I want to have just a quick look at this 30-second video. These are birds. They're starlings at Otmore in the UK. And hopefully you can see. I know it's kind of, I don't know if you can turn the lights off just for 30 seconds. So what you're looking at is a flock of starlings. So hopefully you can see some of that. It's pretty amazing though. And actually I laughed when Milani told me that we were going to do the triangle exercise, because you all did a little of that this morning. Maybe not on such a large scale, but clearly that's a little bit of what we were doing. So what's interesting and what allows birds to flock and bees to move essentially as one body, what looks to have one mind, scientists have observed that there are essentially 3 rules of interaction that allow those birds to fly like that. Even though there are thousands and thousands of them, they all turn at exactly the same moment, and they move really as one. And those 3 rules are simple. Travel at the same speed as your neighbor, maintain equal distance from your neighbor, and always turn toward the center. Sounds a lot like our triangle exercise this morning. But I think that nature is instructive. These are simple rules for interaction that help to govern really complex motion. And in much the same way, we in the social sector have some simple rules for interaction that allow us to address complex social problems and to adjust as we go. And so, as we looked at cross-sector efforts that have made a positive, consistent, and large-scale progress over multiple years, we found that all of these successful initiatives really had 5 things in common. Rules of interaction, I would call them. The first is a common agenda. And by this we mean that all the stakeholders that are working on a problem together have a common understanding of the problem. It's a lot harder than it sounds. They all agree on what the problem is. And they agree to take a joint approach to solving it through joint action. So that's the first piece, common agenda. The second piece, which is so often missing from our collaborations in the social sector, is shared measurement. And the idea behind this is consistently measuring results, just a few indicators. It doesn't have to be more than a handful, but indicators that everyone agrees to are important for measuring progress, are measured consistently and where folks can really look at it together. It creates accountability, and it also allows you to see what's working and what isn't working as you go along. So shared measurement is absolutely critical. The third thing that we see is mutually reinforcing activities. And the idea here is that not that all the stakeholders do the same thing. That wouldn't make any sense. But rather that the different partners in the effort bring their strengths to the table. They understand their own strengths, but they also understand what the other partners are doing. And they proactively complement each other. So we're getting away from duplication and really understanding what those reinforcing activities are between organizations. Fourth, we have continuous communication. So this means that not only do you have to agree on what you're doing, use common measures, and understand what your role is and others' roles are, but you have to talk about it. Continuous communication is really critical for talking with each other about, I'm doing this, you're doing that, this is working, this is not working. And frankly, it's also a key ingredient to success that we see in collective impact, and that is trust. And you can't build up trust without talking with one another. So common agenda, shared measurement, mutually reinforcing activities, continuous communication, and the last one, last but not least, is the backbone organization. And by this, we mean essentially dedicated capacity. In some cases, it's one organization. In some cases, it's multiple organizations. But dedicated capacity to hold the whole effort together, to keep the focus on the common agenda, to measure the data around the shared measures, and make sure that everyone's looking at it together, to connect the dots between the different organizations that are working together, and essentially to help to move the whole effort forward. The backbone organization is absolutely critical. And again, is frequently missing from typical collaborations that we see out in the social sector. So you may be thinking, okay, common agenda, shared measurement, mutually reinforcing activities, continuous communication, backbone organization. I get those things. Those all make sense to me. And I imagine that many of you have seen those elements in your work, in many cases. But I think what is often missing is all 5 elements at once. And it's quite rare to find efforts that are really firing on all 5 cylinders of collective impact. But that said, we have seen it, and we've seen some wonderful examples. I think one of the exciting things about collective impact is that it is truly relevant across really any complex social problem out there. We've seen examples across education, healthcare, homelessness, the environment, economic development. You name it, we've seen some wonderful, wonderful examples. It's highly relevant, these rules for interaction around solving complex problems. So just to give you a flavor for some of these examples, some of you may be familiar with the STRIVE effort in Cincinnati and Northern Kentucky, which is essentially a cradle to college and career education reform effort. And that's involved over 300 cross-sector partners. Public schools, universities, after-school providers, faith-based organizations, businesses, foundations, housing authorities. And STRIVE tracks essentially 34 indicators of student success every year. Those are their shared measures. And last year what they saw was that there was positive progress on 81% of those measures. The year before that, it was 74% of measures, and the year before that, 68% of measures. So things are really moving in the right direction. And by having those measures in place that everyone looks at, it's really helpful for them to understand what's working and what isn't. There's a similar Cradle to College and Career effort just up the road in Seattle, where I live. And Lyle mentioned that one, the Roadmap effort in South Seattle, South King County. And I know there are some really exciting efforts going on now here in Tacoma around education reform as well. So something that we're now seeing across the country in multiple communities. Healthcare. There's an effort called Shape Up Somerville, which is in an ethnically diverse suburb of Boston, about 80,000 people. And this effort is really focused on childhood obesity and reducing childhood obesity. It involves 70 cross-sector partners, including the schools, the city government, restaurants, Tufts University, a number of really critical players in that community. And what we've seen is that in 3 years, Shape Up Somerville has been able to reduce the body mass index of kids in that community by 15%. I don't know if you guys have ever been on a diet, but that's really quick. And it's particularly interesting that, you look at the child population, 44% of the kids in this community were obese at the beginning of the effort. So really exciting progress there. Workforce development. There's a cross-sector effort in Chicago called Opportunity Chicago. It was initially catalyzed by leading area funders in that community, but ultimately included government, businesses, and dozens of nonprofits in a cross-sector effort. Their goal was to place 5,000 public housing residents, train them, and place them into new jobs. This is during, of course, one of the biggest downturns we've had in the history of this country, and they actually more than achieved that. They placed 6,000, so exceeded their goal. And then finally, youth substance abuse reduction. So this is a really interesting example. In 2002, Franklin County, which is a very rural county in Massachusetts, had one of the highest substance abuse rates for kids in the whole state. And so they launched an effort called Franklin County Communities That Care. It brought together over 200 representatives in this rural community, police departments, healthcare professionals, youth-serving agencies, faith-based organizations. And in 8 years, they've been able to reduce binge drinking by 46%, smoking by 44%, and marijuana use by 28% among the youth population in this community. Much more dramatic improvement than what we've seen for the state or national figures over the same time frame. So again, really great evidence of significant progress where communities have come together around a clearly defined issue and work together in solving that problem. So some of you may be thinking, okay, well, this sounds like an interesting approach, but how do we know if we're ready to take this on? What do you actually need to be able to launch something like this? And what we found is that there are really 3 key readiness factors that are critical around collective impact. The first one is urgency for change. This is a big one. There has to be a real desire on the part of the community for something different to happen. We've seen examples where a catalyst can come in and create this, new funding, for example, or a change in legislation that can create a window of opportunity around an issue. And in some cases, what we've seen is that communities have literally reached a breaking point where all the players that are working on an issue are so frustrated that they've been working on this issue for so long and made so little progress that they are really ready to do something different. But there must be that urgency for change at the beginning. The second key success factor that we see in getting these things started is an influential champion or champions that really is representative of the issue, that have the credibility to represent the issue, the ability to bring together the key players around the table on that issue, and that are not viewed as in it for their own benefit, for their own organizational, personal benefit. So in that sense, are viewed as more neutral leaders on the issue. And in every case, you can point to a few key leaders that allowed change to happen. In the roadmap effort in South Seattle, South King County, those included Norm Rice, the former mayor of Seattle, David Bly, who heads up the Pacific Northwest Initiative at the Gates Foundation, and Mary Jean Ryan, who's on the State Board of Education. Those 3, along with many others, really played that critical catalyst champion role to get the ball rolling around education reform. But in every case, that is a critical ingredient. And then finally, this is probably not going to be a surprise to you all, financial resources. Not a huge amount, but there needs to be funding that is dedicated to the process of collective impact, to convening the players, to putting the data together, to having the meetings, to deciding on a common agenda, to collecting the data that all the players can use and look at together. So that is a critical ingredient as well. You need to have at least one anchor funder who understands the importance of the infrastructure and the planning processes around collective impact. So how does this play out? I'm not going to go into a lot of detail here. In some of our articles, in particular Channeling Change, we talk in a bit more detail around what does this look like, how does it get started. There are 3 very basic phases to collective impact, and I should be clear about the fact that this is highly fluid. These are rules for interaction. It's not a model in the sense that it looks different in every community. But in general, there are 3 phases, and the first phase is around initiating action. So this is where the group really comes together to define the problem What is the problem that we're trying to solve? Finding out what those bounds are, much as we were just talking about this morning. Understanding the landscape of key players that touch that problem. Establishing the data on the problem. What does the baseline tell us? What is the current situation around this problem? What do the numbers tell us? And also establishing an early governance structure that includes those strong and credible champions and hopefully at least one funder to help you to move forward. So that's sort of the first rough phase. The second phase is organizing for impact, and this is typically where you see stakeholders working together to establish common goals and shared measures. So we agree on the problem that we're trying to solve. Now, what are we going to achieve together around that problem? And how are we going to know? What are the measures that are going to tell us? Putting in place that supporting infrastructure if it's not there already. So what's the backbone structure? Who's going to help us hold all of this together? And then beginning the process of aligning multiple organizations against those shared goals and measures. Roughly the second phase. And then the third phase, which we refer to as more sustaining action and impact, that's when the stakeholders really engage on those prioritized areas of action. Okay, we've got a common agenda, we've got shared measures, we've got a backbone to hold this all together, but now we actually have to do something. We have to work together differently in order to really achieve our goals. And that means collecting the data, but also importantly, putting into place processes that enable learning, active learning among organizations about what's working and what isn't. So that really is sort of getting really into the meat of collective impact. And I should tell you that this is not a sprint. We're talking about systems change. That is not one grant cycle. It is not 1 year. It is not, in some cases, even 5 years. And so typically what we see is that the first two phases here, initiate action and organize for impact, can take 6 months to 2 years to happen. So it's really important that folks are committed for the long term over creating real change against these issues. So the last thing I wanted to talk about, and then we can get into some discussion, is that this is a different way of doing work from what most of us are used to in the social sector. And so for organizations that are really committed to moving from a paradigm of isolated impact to collective impact, there's often some huge mindset shifts that need to take place among all the organizations that are involved in this work. And the first one that I wanted to talk about is adaptive problem solving versus technical problem solving. So technical problems are essentially problems where the solution is known. It could be something as simple as baking a cake, right? Unless you're my husband, if you have a recipe, you can bake the cake and pretty much get the same result every time. That's a simple technical problem. It could be even a complicated technical problem, like sending a rocket to the moon. That is not easy. It takes a lot of experimentation, deep science, and research, but once you figure it out, if you do the same thing, you can reliably get the same results every time. That's a technical problem with a technical solution. But of course, the problem is that most of the problems that we are trying to solve in our communities are not technical. They are highly adaptive problems. And by that I mean there is no single answer. If you do the same thing, you won't necessarily get the same result. There are multiple forces at work on the problem. It's constantly shifting in terms of politics and the different stakeholders that are involved, legislative change, different folks coming to the table. So these are highly, highly adaptive problems. There's no single recipe for success. And what that means is that the stakeholders that are working on that problem have to work adaptively. They have to jointly problem solve and adjust as constantly as they move forward. And this really requires doubling down on the interstitial stuff. And by that I mean the relationships between organizations. So facilitation that leads to a common agenda and common strategies. Mapping tools that help stakeholders to understand the overlaps and gaps and information flows in the system. Data systems that enable the collection and sharing of data across organizations so that you can learn about what's working and what isn't. But these are highly adaptive problems that we're trying to solve, not technical solutions. So that brings me to the second mindset shift. There are no silver bullets to the problems that we are trying to solve. But there are silver buckshot. And that is what's important here. So we need to move from seeking the silver bullet answers, the one program, the one organization, the one intervention that's going to solve these problems, which doesn't exist, to really trying on multiple fronts to solve these problems. Multiple stakeholders working on multiple different things that add up and can add up to really substantial change in our communities. And what we have seen in time after time, many examples that I just provided, is that collectively, many small-scale changes can really add up to large-scale progress within a community. So, required mindset shifts. Adaptive versus technical problem solving. Silver buckshot versus silver bullets. The third one that I wanted to talk about today is a really critical one. And that is the tension between credibility versus taking credit. And frankly, I will tell you that the desire to take credit is probably the single biggest reason that we have isolated impact in our sector today. It makes sense, right? If you're a nonprofit, then you want to show what you're accomplishing through your own activities so that you can get funding, scarce funding. If you're a foundation, you want to be able to explain to your board what it is that you're accomplishing through your individual grants and activities. If you're a corporation, then you want to be very certain that you have a good reputation in your community and that the grants and activities that you're making are attributable to you and can add to that reputation. So it is the normal way of doing business in the social sector today, but it is highly, highly damaging to our ability to get to large-scale social change. And so what that means is that all organizations really need to constantly revisit this. To what extent is what I'm doing right now better for me as an individual or as an individual organization versus better for the whole and making real progress against this social issue that we are all working on? And so really finding that tension and being conscious of it between credit and credibility is a critical, critical mindset shift that we need to see to really make progress. So just to repeat those mindset shifts then, adaptive problem solving versus technical problem solving, silver buckshot versus silver bullets, and finally this ability to create credibility rather than take credit. So here's the thing that we all know. We live in a time when the complex and crippling social problems that we all face are coming to a head. And the fact is that we're entering a period now for at least 10 years where we know that public funding and resources will be far scarcer than they have been in the past. So what that means is that we absolutely must get better at change through more disciplined and effective collaboration that uses the resources that we have at our disposal today. And the last thought I'll leave you with, and then let's open it up for discussion, is that while achieving collective impact is not easy or quick, it's really not, it takes people like you to make it happen. And there's a wonderful African proverb which I think captures so well the essence of collective impact. And it goes like this: to go fast, go alone. To go far, go together. To go fast, go alone. To go far, go together. So as we think about where we are today as a society, what the big picture looks like, I invite you to lean away from viewing the problems you work on as depressing and insurmountable, and to join the ranks of communities that are taking a collective impact approach and lean towards a future that is exciting and unprecedented. Thank you. So I know we have plenty of time for questions, and we wanted to leave it that way. I provided a very high-level overview of collective impact, but I'd love to hear what your reactions are, what your questions are around this work. For those of you that have started to do this work, what initially you're finding. But we have some good time for discussion, so I'd love to make it as interactive as possible. Any questions? Anyone want to start us off? Yeah.